Neoliberalism, austerity, and privatization of healthcare. There is a reason why this ideology is so very popular and so hard to overcome, especially with regards to healthcare. You have institutions like the IMF, World Bank, programs like structural adjustment programs having strings attached to loans. This has been going on since the 1980s. Under Margaret Thatcher, Prime Minister of UK, Brian Mulroney, Canadian Prime Minister, and Ronald Reagan, the American President, these issues have been going worldwide. From the NHS, National Healthcare System, which currently, as you're aware, there's a Conservative Prime Minister who is concerned with regards to privatizing parts of the NHS. And in Toronto and in Canada, 24/7 housing centers, so vital for mental health, and the need to fund it was rejected by the City of Toronto. Healthcare around the world is being privatized. When you hear neoliberalism, austerity, and privatization, the first country that comes into mind is America. Fun fact, every year, the Court of State and Municipal Court hears around 300 to 500 cases related to conflicts between patients and medical insurance companies. The major issues are either overbilling or failed negotiation. The health care system of the United States of America is controlled by the health insurance companies, which then also lobby the government, having considerable influence on the healthcare policies and make it very hard for reforms to ever happen. The market can provide solutions to everything, and that's why there has to be certain ways to resist it, like Cuba and its approach to nationalization of healthcare. More community-based approaches to healthcare, which is key to tackling neoliberalism. During the year 1984, Cuba created its one doctor, one nurse plan. The importance of this approach required healthcare teams to reside in their respective communities in order for a better understanding of the local issues. However, this approach was not without its flaws. Although many community members appreciated this effort, other community members saw this as a breach of privacy to their ordinary lives. The UK has a universal healthcare system called National Health Service, also short for NHS. It is a single system generally funded by taxes and mostly free at the point of service. However, the system has been undergoing a set of privatization in the last few decades in the name of cost saving and efficiency. More and more people in the UK nowadays are reaching out to private sector for medical treatment due to deteriorating public healthcare system, resulting in an increase of out-of-pocket costs, especially for the poorest. The household out-of-pocket costs in the 1990s used to be 1% of the GDP, and now it has doubled to the same level comparable to the United States of America. What about mixed market economies like Taiwan, where they do have universal healthcare, but private options and access to the market exist? How does neoliberalism affect countries like Taiwan, or are they affected at all? The Taiwanese healthcare system makes it compulsory for all Taiwanese citizens to join the system. Prenatal care, preventive health services, copay ceilings, and comprehensive coverages, relief loans are given priorities and made sure to be given easy access to the most disadvantaged in Taiwan. On the other hand, the Taiwanese healthcare system also has an aging population to deal with, as well as an insufficient allocation of administrative budgets. So what have we learned thus far? The case study of Cuba highlights the importance of community-driven healthcare. Yet this approach has been criticized by some critics as a breach of privacy to some citizens. The UK example, on the other hand, highlights how austerity and privatization have led to issues like out-of-pocket costs skyrocketing for ordinary citizens. On the other hand, we have also learned the power of the health insurance lobby in America and the power it has in making it very hard for healthcare changes to happen. In the age of neoliberalism, austerity, and privatization, there are no easy answers or solutions. However, based on the healthcare example case studies provided, it is safe to assume that there is no such thing as a perfect healthcare system. Both nationalized mixed market and private healthcare systems each have their own fair share of concerns. However, it would be wise to take into account the lessons from each of these health systems based on their strengths to overcome the various inequalities and healthcare issues that exist in our current global healthcare system.